Hello, my name's Annette Wilson. I'm a physiotherapist. I'm a rider biomechanics coach, and in the recent number of months, I've been studying red light therapy. So what I'm going to talk about today is red light therapy. Now, red light therapy is actually known as photobiomodulation therapy, PBMT. So photobiomodulation is shining light onto tissue, which in the case for an effect is red light and infrared light. And what we're targeting is improved tissue function. We have an anti-inflammatory effect and we have a change in the energy metabolism within the cell. So photobiomodulation has been previously known as red light therapy, low-level laser therapy, high-level laser therapy, or cold laser therapy. So it's now been standardized to be called photobiomodulation therapy. So the literature can collate and have a standard keyword and data research language. So it's now known as photobiomodulation therapy. So PBMT is the application of light into the body to affect change at a cellular level. So we use red and infrared light, and these are the main wavelengths. So red light is visible and infrared light is invisible. So in the visible spectrum, the wavelength depth is measured in nanometers. So infrared light penetrates deeper because it's beyond the 800 nanometer level, and red light penetrates less deep and it is visible. So we have a quick look at this. Visible light is from a depth from 400 through to 800 or thereabouts. So we've got the various colours, and as the penetration of the light goes deeper, we can see the wavelength gets less congested. So the peaks and the troughs increase in distance, and then we go beyond red light, which is invisible red light. Now, just to put into some perspective, visible light and infrared light sits in the electromagnetic radiation spectrum. So how does PBMT work? Red light and infrared light penetrate into the tissue, as I said, at various wavelengths. So the wavelength is the depth and it's measured in nanometers. And as I said before, the longer the wavelength, the deeper the penetration. So what happens when the light is penetrating through the tissue is that the light is absorbed by chromophores. And the target chromophore for PBMT is the cytokine C oxidase chromophore. And this chromophore sits within the membrane of the mitochondria cell. Now, other chromophores that absorb light are melanin, hemoglobin, and water. So chromophores that absorb light that we need to consider, as I just said, melanin, hemoglobin, mitochondria, and the water. So melanin sits in our epidermis, and it provides a pigmentation to our skin, eyes, hair, and it protects us from sun damage. Now, we all know that melanin increases in our skin when we get sun, and that's what we call a tan. Hemoglobin is essential for transferring oxygen in our blood from the lungs to the tissues, and hemoglobin is within our red blood cells. Mitochondria is the powerhouse cell in our body, providing energy for all bodily functions. And the mitochondria is in every tissue, but it's very dense in muscle tissue, heart tissue, and brain tissue. It's also quite dense in our organs, liver and kidney. Now, water is everywhere, and water carries the nutrients and oxygens to our cells. It also lubricates our joints, and it lessens the burden on the kidneys and the liver by flushing out our waste products. Water also helps dissolve minerals and the nutrients to make them accessible to our body. So these are the four main chromophores that we need to consider in photobiomodulation therapy. So the penetration of depth is different to the absorption of the light. We know that the longer wavelengths penetrate deeper. We know the superficial wavelengths penetrate shallower. So what we need to look at is what happens re the absorption of the light into these chromophores at different tissue depth or penetration. So we can see on this graph that on the bottom wavelength we go 0.1 to 10. That's where the wavelengths get longer and deeper. We can see on the vertical axis 1 to 1,000. So when we are in the shallow wavelengths, we have a lot of absorption in melanin and hemoglobin. As we go beyond, like the one here, we go into a deeper penetration, but the wavelengths pass through the melanin and the hemoglobin, and then they're absorbed into water. And as the scale goes more to the right, we can see that water is penetrated at a very shallow, at a very extensive level in the longer wavelengths. So the depth of penetration and the amount of absorption needs to be considered. Now, when we want to absorb light into the cytochrome C or the mitochondria, the depth or the Goldilocks depth is from about 600 to just about 1200. And there's a lot of research to prove that. So why is the mitochondria and the cytokine C oxidase chromophore the primary target? When light hits the membrane of the mitochondria, so we have the red light come through and hit the blue membrane, it activates the chromophore cytokine C oxidase, and then we have what's called a cascade of cellular reactions, primarily ATP, ROS, and nitric oxide. ATP is increased, and this increases the cell's ability to fight infection and accelerates tissue healing. And this is a proven scientific fact. ROS is the reactive oxygen species. These activate transcription factors, and this has a positive impact on cellular repair and healing. Third primary reaction is the release of nitric oxide. And this is a very powerful vasodilator. It increases circulation, it decreases inflammation, and it enhances transport of oxygen and immune cells throughout the tissues. So the mitochondria has a significant function as the powerhouse cell, and the cytokine oxidase, when activated, kickstarts that cell into a cascade of positive cellular responses. So the maximum absorption and wavelength, again, has been well studied. The depth of the effect is quite wide. So the maximum absorption of light into the mitochondria happens between the 600 and the 1200 nanometer depth. Now this scale only goes to 900. So many have cited the maximum absorption happens around 810 and again at 905 nanometers. So if we follow the blue line here, we can see the peaks of cytokine C absorption. So around the 6th, highest around the high 600s. We have another peak around the low 800s. And if we follow this blue line beyond 900, we would see it peaks again around the low 900s and then it drops off. The absorption after the 900s and the high 900s into the 1000 nanometer wavelengths is predominantly water. So what does PBMT do? As we've said, we've got light shining on the skin. It changes the mitochondria, and then we have a metabolic alteration and significant changes in particularly anti-inflammatory effects. So inflammation is the result of every trauma, infection, illness or disease in our body. Cause or effect or cause. Inflammation is a normal response and acts to protect and start the healing process. So if we have an injury, we immediately have inflammatory cells come in to help. Too much inflammation, though, inhibits healing. And this is where we move into the chronic stages of disease. So the PBMT targets the cellular action to reduce the inflammation and promote the normal healing. So basically what we want to do with the light is promote what should happen normally instead of one thing too much or not enough. So the effects of the laser and or the LEDs to promote the APT production, we've already seen that, promote collagen, modulate inflammation. Here's the one we haven't discussed, is inhibit bacteria growth. There's a lot of evidence out there that the shorter wavelengths, the blue and the red, can change bacteria at skin level and certainly in wounds. As discussed, promotes vasodilation. It also can alter nerve conduction through velocity and regeneration. Red and infrared light has been proven by thousands of studies to have an inhibitory effect on pain and an activatory effect on inflammation and tissue repair via the cellular response. So we use lasers or LEDs to improve tissue repair and healing, to reduce pain and inflammation wherever the beam is applied. Is a growing form, and this is a growing form of effective, safe, endogenous treatment with no reported side effects for many conditions. So our mitochondria cells are in every tissue and they provide energy. The mitochondria are affected by infection, disease, trauma, stress, and age. A reduction in function is the effect. Miserable mitochondria is a term associated with all disease, because with every disease we have a change in the function of mitochondria. So what happens with loss of energy and fatigue, loss of strength, weakness in the muscles? We can have a weaker heart muscle, loss of brain function, increase in inflammation, poor healing, disease, and chronic disease. So the mitochondria here has many effects on many actions or cellular actions and reactions within our body. So if it's the catalyst or the starting point for many of these conditions, then it seems logical that we should start to look at what this cell does and what we can do with it to make it function better. And there it is. It seems logical to keep the function of our mitochondrial cells as normal as possible. So the key to success in PBMT is using the correct wavelength or wavelengths. There are studies to say that when we use 2 or 3 wavelengths synergistically, we can have a better outcome. Power is the amount of energy that forces or pushes the photons, which is the light, into the tissue, whether we have contact on the skin or whether we have a beam from further away, and the light source. So the depth of penetration, the deeper the penetration, we need more power. If we've got contact with the skin, we will have less reflection and scattering. We also look at the absorption, which we've been discussing already. So these have a big effect on the outcome of using PBMT. Now the sources of PBMT: laser and or LED. LED is a light emitting device. Both emit red and infrared light. Lasers are generally classed 1 through to 4, and they're classed with respect to power. So laser is generally a high-powered device. It's for use for professionals only, and it does come with safety considerations. So laser is generally a high-powered, collimated, monochromatic, coherent beam that is driven deep into the tissue in one straight line. LEDs are generally low power. They're used both in clinics and for home use. LEDs require no safety considerations, so you don't need goggles. They're easy for home use and have the ability to irradiate a large area of tissue at once, and of course you can wear them. So the difference between an LED light source is that it's not coherent, so the wave beams don't line up together. They're a little bit out of tune. It is still one wave source, so it is monochromatic. It's generally less power, and it tends to scatter within the tissue rather than be directed in a single line. So both emit red and infrared light, and both are very useful in the treatment for PBMT. So PBMT, pain, injury and disease. It treats the underlying condition or the pathology to promote healing, reduce inflammation and give relief for both acute and chronic pain. It has an effect in neural regeneration and nerve regeneration in neuronal tissue, and this enhances function. It increases blood flow in the brain. It also appears to have an effect on damaged brain cells. Cell death by amyloid beta in neurons are inhibited with PBMT. So what that means is that when we get brain injury, dementia, Parkinson's disease, the absorption of light through the cranium into the brain can change not necessarily the pathology, but can increase the healing and the function of the brain by promoting function of the mitochondria. And these are proven in many, many articles. So it's used in injuries to improve soft tissue healing. So we get less chronic conditions and we get faster healing from the acute condition. We get fast wound healing. Light stimulates the building blocks of collagen, which is important in the wound healing of damaged tissues, and it's an essential protein to replace old tissue to repair injuries. So laser is effective for open wounds and for burns. So just recapping that slide, because mitochondria is the target and mitochondria is damaged in so many conditions, simply by stimulating the mitochondria, we can have an effect on those conditions, not necessarily cure them. So the conditions that would benefit from PBMT: chronic inflammation, back pain, neck pain, arthritis, muscle, joint pain, sports injuries. Huge area and a lot of research going on in brain injuries, nerve. You can use it in the beauty therapy for acne, wrinkles and scars because the shallow wavelengths affect the collagen and the blood vessels and have an effect on regenerating the small nerves and, as I said, wounds and skin conditions. And we've already had a look at the effects of laser and lights. LED devices that can be used for home. These are everywhere. You can buy them on just about every website that's selling home devices. They most come with a standard wavelength of 660 and 850, and they have various power controllers. So you can get one that's remote, a hand or a button controller. Now the 660 and 850 two wavelengths were put in just about every device that was manufactured anywhere around the world because it seemed that was a wave, an area that was successful and nobody challenged it. Well, what's happening now, and certainly this is what I'm doing with my studies, is challenging better wavelengths or other wavelengths for a better outcome. So you can buy them over the shelf anywhere, and that's what you'll get. Most of them have power for 240 volt and or a US power bank adapter so that you can be portable. Most put out continuous and or pulsed. Many have a combination of wavelengths, but the settings you can use it with a single wavelengths. Prices are variable. Quality is also variable. It seems that animal devices copy the human device, but with a plastic cover over the lights. Until recently, the research didn't support the use of human devices for animals for the same outcome. But again, ongoing research there, and certainly what I'm looking into, is starting to evolve with some new information. Again, the pulse mode in some research is more effective than the continuous mode. Many research says pulsed, others says continuous. I tend to use pulsed when I'm using a red light device, and my own experience is it's better. LEDs are effective for pain control if they're used often. So because an LED is a low powered device, the amount of energy getting onto the light is drip fed to these cells rather than pushed powerfully through this tissue by a class 4 laser. So when you're applying it through dark skin and or hair, it seems that the 915 and 980 up to 1064 nanometers provides the best absorption for pain relief. Again, studies are ongoing. So how do you use a home device? It must be applied to bare skin. I have seen people put it over a t-shirt. If you put it over a t-shirt, you've got a glorified heat pack. It's also preferred that you have a little bit of pressure on the device, through the device onto the skin. Don't force it or you may damage the LEDs. You can use the straps or some body wipe to apply the pressure. Most of them have an automatic timer, no more than 30 minutes on one body part at a time. You can apply it once or twice a day, and you may use the device on multiple areas. The effect of the light is where you put it, but you do get some systemic effect because it is picked up in the hemoglobin within the blood, and then it's carried around your body. Continuous wave provides heat. Pulsed wave will allow a high pulse setting, power setting, while it's non-thermal. Pulse wave may give a better pain response than a continuous wave. Keep it clean with a soft wipe. Take care with the power inputs, plugs and leads, because they can be yanked around and pulled around and tear the leads, and then your device doesn't work. Some of them only have a 240 volt power, and others have both. Don't get the pad wet or put it in damp areas. It is an electrical device. Safety of PBMT. There's no reported side effects in any of the literature. However, you do need to be careful. If you've got it, it is an endogenous treatment. So what the light is doing is activating your own healing process, homeostasis, cellular reaction within your body. So we're not introducing a drug or any toxins. We are putting light through the skin to be absorbed and to activate a reaction. It's technically non-thermal, although sometimes the LEDs can generate a little bit of heat. If you have it too hot, we get what's called a thermal response rather than a cellular response. They're bought as an over-the-counter device, so they don't necessarily come with a lot of instruction on how to use them or why to use them. You have to take care with dark skin, and you have to be careful if you are photosensitive. And I always suggest people know the specifications of their device, and if not, ring whoever you bought it from. Contraindications. Now, as much as there's no reported side effects, there are still conditions and circumstances where we don't want to put light through tissue just because we really don't know what it does. You do need to wear goggles for class 3 and class 4. It's not a contraindication, it is a significant safety thing to be aware of. Pregnancy, cancer, chemotherapy, epileptics, acute bleeding and electrical devices. You need to avoid using PBM in those conditions. Now, cancer, because the activation of the mitochondria increases the cell action, we avoid using it on cancer. However, there's a huge amount of research coming out to have a look at proving that there are benefits. But if you're going to use PBM and you've got cancer, you certainly need to be speaking to your professional. Same with chemotherapy. It can be used to reduce the side effects, but you don't use it in conjunction with chemotherapy. You can use it as a side, but again, you need to be consulting your consulting professional. Epileptics, probably need to avoid it because when the light starts flashing, it may activate a seizure. Again, if you feel that you can use red light, you certainly need to be talking to your professional. So summary and conclusion. So what I've done is just gone clinically, discussed the clinical, what is phytobiomodulation, what it does, how to use it, what devices to use it, safety and precautions or contraindications. Basically, we use PBM for pain. Pain is a serious and common, and you must be assessed and treated, go through a rehab program and manage it properly. You must undergo some sort of rehab in conjunction with all your other treatments because movement is the key. PBM is an adjunct. Managing pain at home can be done using drugs, heat, braces, core strength training. PBMT is now a form of treatment to self-manage acute and chronic pain, and I'm certainly a big fan. Treatment should be applied as needed. Advice must be followed. Manage no pain. Now, by that, if you've got pain that's been quite serious and then it's settled down, but you're still in the healing phase, you need to manage no pain. No pain is not healed. This is something I tell my patients all the time. Because if you go out and challenge no pain, your resilience to trauma, if you're not healed, is less, and you might end up where you started. So you can return to a full life when advised. This is post-injury, but if you're managing chronic stuff, hopefully things will just get better. So I'm happy to talk to anyone about this topic. You can get in contact with me through my website. It's easy through my website. So any questions, again, because this is a recorded presentation, you can contact me through the website and send me an email, and I'll endeavour to answer any questions. Here's the links to articles. I have written a presentation on the literature. This is a clinical presentation, but all the information has certainly been sourced through various articles. So there's one page and there's the next page. If you want any of those articles, take a screenshot or you can contact me. Here's my contact details. My horse riding website is appliedpostureriding.com.au. I have various products and training programs on there specifically related to my physiotherapy and my rider biomechanics coaching. And I also have the Redlight therapy pads that I use with horses and for pain. Also, Redlight Physiotherapy is another website that I use to sell Redlight pads, mainly for horses at this stage. So thank you for your time. Any questions? I'd love to hear from you.